Welcome back. How about a unique approach to treating back pain? Well, Dr. Frank is joining us. Frank Dockler is joining us here from Broadview Health Center with more information on it. Thank you so much for being here today.
Well, thank you for having me.
It's good to see you. Now, I mentioned back pain, but really you have a lot of things up here. I mean, all of the things that we go through, they're kind of all woven together and linked in some way, right? And that's what you help with.
Yeah, so back pain, right, it's the third most common reason that people would visit their physician. So it's very common, one of the most common reasons that people have disabilities. But back pain isn't always just traditional chiropractic, adjust here and there. There's a lot more components to it. So at Broadview Health Center, we take a much more holistic approach. And I know people use that term all the time, but I truly feel that that's what we do. So as we're doing the adjustments, it might be a deficiency in a certain supplement. It may be something that we need to help them increase blood flow to the area. There's some bracing. There's some different types of stimu units that they can either use in the office or sometimes even at home.
So what is you said maybe if there's a deficiency, we work with supplements. What do you initially do? Blood work. What is the initial steps that happen when they come in?
Yeah, so the initial, it's a little bit different for everybody. It depends on what their condition is, but they all start with a consultation and examination. So we spend a great deal of time just sitting down with the individual and learning more about what's going on. Just to say, well, my back hurts, was, well, how did that happen? And how do you sleep? And what's your mattress like? And what do you do for a living? So it really does rely on a good consult and getting to know the individual at a very, very deep level.
And so say their issue is back pain. Then what would be, after again, you're asking those types of questions of them,
Yes.
trying to figure out maybe what the source is, and then how do you take them through the process of maybe healing or recovering from it?
Well, we start with x-rays. We may order some MRIs or some other testing. Sometimes it involves chiropractic adjustments. Sometimes we may be putting them in a rehabilitation program. Supplementation, as I mentioned, magnesium, vitamin D3. Many times it's just a multivitamin issue that they're lacking certain B vitamins in their system. But as we start to address those things, an individual starts to feel better. And that's really what it is. I know you have a lot of people at home right now and they're in pain. They have a knee problem, they have a knee problem or a back problem. They have an issue with their weight or they're feeling horrible in the morning. Well, we can work most individuals through that process and take them from one point, and 12 months later, they're a completely different human being.
Now, is this something that we would need to get another doctor's referral for to come to you, or they can just come in and get, and again, there's probably, as you said, there are probably a lot of people out there right now who are suffering from some kind of pain and they just live with it and they just think, well, it is what it is.
Yeah,
and they shouldn't.
Or they've had it looked at and they've been told, this is just how it is, or you're getting old, or whatever the answer might be, or they've just been given a medication. And sometimes the medications have their place, but you can't take something for pain forever.
Absolutely, and I think that's a great point to bring up. You can't just rely on a pill to fix all of your problems. And so then, again, things like therapy, physical therapy, that you're helping them through the process to really adjust the situation.
Yeah, so not only will we take them through the therapy within the office, but we're teaching them things they should do at home. A very low-tech rehab, balls and bands, stuff that they could pick up at a Walmart or on Amazon for just a few bucks. It's about lifestyle changes and habits, and that's we take a great deal of pride in our education process as far as just bringing them in, helping their families, and letting them live a longer, more quality life.
Normal. We think we feel normal, but I don't think most people understand including me, what normal really feels like.
Right, until you make those changes, and you're like, wow, I felt horrible for all those years. Yeah, I agree. We should all wake up and feel good. We should all wake up and be happy. We should not wake up with a stomach ache or feeling like we have to have our morning coffee. We should have that natural energy. That's what's normal. And
so getting to that is so important, and I hope that you can then reach out to Dr. Frank, figure these things out. BroadviewHealthCenter.com is their website. And your location again?
Broadview Heights.
So it's right in Broadview Heights. Now, I'm just looking at some of the quick things you have here. What is this guy for? Back pain right here?
We can use it for back pain. You can use this primarily for neuropathy. Reversing the effects of neuropathy. These are different types of red light therapies that can be used in the office or at home.
I'm hearing
different
so
types
much more and more about red light therapy.
Amazing things coming up with red light and different frequencies, but the thing is you have to match the proper frequency with the condition. So we have red light in the office that we can use for weight loss. We have different frequencies for acne care, psoriasis, pain. These are just some of the examples of what someone can use at home as well and actually reverse the neuropathy condition completely.
Wow. So from that to supplements to other devices devices that look like contraptions I've never seen before, but I'm sure are really...
Low back decompressive brace for disc herniations and bulges, takes the pressure off the nerve roots, and all that tingling and shooting pain down the legs can just go away.
There's so much, and that's the good news, because he can help sort through all of that, because there's a lot of information. He can break down, figure out what is ailing you, and get you on the path to feeling healthy and just feeling normal, and I love that. So again, Broadview Health Center is a place to go in Broadview Heights. Thank you so much for being here today, Dr. Frank.